Thanks so much. So, as I was saying, here today we're going to be talking about living with loss, specifically the losses associated with a cancer diagnosis and the grief that comes along with that. So, first, I always like to talk a little bit about just a background, why we're here. I want to acknowledge that facing and talking about loss takes strength and energy, and a cancer diagnosis has not only physical effects, but mental and emotional effects as well. So that can bring a lot of different kinds of losses. Some might be visible, some might be hidden, and that can impact both the person with the diagnosis or their loved ones as well. Today, we're going to talk about a type of grief that isn't always acknowledged, the type of non-death grief associated with those losses, and we'll look at some suggestions on how to navigate that. So what is grief? When we think about grief, we often think about death, but grief is actually the emotional reaction to any significant loss. For the purpose of today's talk, I always like to have a shared definition just to distinguish between grief and bereavement. First, grief is the emotional response to a loss, while bereavement's the period of time after that loss when a person grieves. And it's important to remember that grief, while some people may see it as negative or what people think of as negative emotions or emotions that aren't comfortable to be felt, it's very natural. It's a human process, and it's not something to fix. It is something to move through. And it can be really difficult, but there are some common experiences across grief that we'll take a look at today. As we've said, cancer can bring many different kinds of losses. Some, like the loss of life, may bring about a type of grief because it's actually happening, or maybe just the anticipation of it happening. And that could be for yourself or for a loved one. Others are physical. So when we think about things like hair loss or even losses of body parts, some people have necessary surgeries and that can create loss. Or even loss of something like energy, right? So thinking about fatigue. And there are also emotional losses as well. That would be things like identity, the loss of independence, the sense of safety you might have felt before your diagnosis. A lot of people are healthy before they receive a cancer diagnosis, and so that can be a loss in itself. These are all very real losses, and so we'll be discussing them today. So let's take a little bit closer look at these. So with physical losses like hair loss or loss of a body part, they're often visible, right? Other people might be able to see those changes. You can see those changes. And sometimes that makes it a little bit easier to understand or maybe even talk about because they can be concrete or tangible. Sometimes it just makes it a little bit easier to understand for both yourself and others. But even when they're understood by others, they can still carry this really deep emotional weight, especially when they're tied to your identity or control. I like to think about, if someone is going through cancer, maybe they have chemo and are experiencing hair loss, they might go out to the grocery store where not everyone knows yet that they have cancer. But that's not necessarily something they get to decide whether to tell other people. People might make assumptions if they see hair loss about what's going on. And so that's a choice that was taken away from them. Sometimes people feel like they have to tell people about a cancer diagnosis before they're ready because of physical losses that give it away. And then emotional loss. So on the other hand, when we think about emotional losses, like the loss of expectations or social roles, or even safety, they can be harder to see. You might miss a role that you once played, or you might feel disconnected from your old self, but not necessarily identify it as something you grieve. Because they're invisible sometimes, not everyone either anticipates that you're going to be experiencing them or really understands without having something that's tangible. And it's not always labeled as grief. So, because they're invisible, that can make it harder for not just yourself, but other people to know that you're going through it, right? Unless you're upfront with them. And that can lead to a lot of loneliness or isolation sometimes. Even if you're surrounded by people who care, sometimes it's just hard to understand. So, what do we know about grief and all these losses? Grieving things like losing your health, your social roles, your identity, it often mirrors the grief that we feel after a death. It might come in waves, where some days it feels manageable, other days it might be overwhelming. And maybe that's even happening within the same day, right? Maybe even hour to hour. Sometimes people wake up in the morning feeling a little bit better. They feel like they're making progress, whatever that might mean. And there is a reminder that pops up. Maybe you caught a glimpse of yourself in the mirror, or something else happens to remind you of everything you're going through. And it can be almost like an ambush of those feelings, to kind of go back and forth between feeling okay and feeling that intense grief. Um, Grief doesn't have a neat timeline. It often reappears at unexpected moments with its ups and downs. So what does grief look like? Of course, grief doesn't show up the same for everyone. It can show up in a lot of different ways. Sometimes it can be through an emotional response, like things like sadness, anger. Sometimes people even feel numb. Um, Some people experience grief more cognitively. That could be like a struggle to focus, or you might feel like your memory isn't as strong. Maybe even physically, you feel really drained. Um, and behaviorally, too, that can impact people. So even if you're feeling like you have energy, you might just feel like an inclination to withdraw from others. Um, and just like when we think about grief after someone dies, grief of non-death losses can impact us spiritually as well. You might start to question some of your beliefs. All of these reactions are normal. Oftentimes, people will experience a combination of these different kinds of feelings. And it can be really hard to tease out exactly what is happening for people. So a lot of times, whether you are the person yourself with cancer or your loved one has cancer, that can lead to other reasons why you might be feeling tired or having these kinds of effects. Maybe it's because of treatment, maybe it's from caregiving. Grief often is low on the totem pole of to kind of go to explain what you're experiencing, but it can help provide a context for what's going on amidst all these losses. In addition to experiencing grief differently, there are actually different kinds of grief as well. So today we'll talk about just a few different kinds of grief. One common form is anticipatory grief, which is a lot like it sounds. We grieve sometimes before a loss even happens, when we're anticipating it, when we think it might happen in the future. If you're facing like an uncertain prognosis, perhaps, or imagining what could happen in your future, you might start to grieve those things. And whether or not that loss happens, the grief is real regardless. And this can affect patients and caregivers alike. It can be over physical things or emotional things, and over your expectations for what you wanted your life to be. The next type of grief we'll talk about is complicated grief. Sometimes grief can become especially intense or long-lasting. You might feel stuck, guilty. There might be some shame around your guilt, or might have you feeling empty. If you're noticing any of these feelings and you're noticing that it is really disruptive to your life, I don't mean, uncomfortable. I mean, making it really difficult to kind of complete basic tasks of everyday living. That's a good sign to seek support, right? I always like to mention complicated grief because it can look a lot like depression, and like depression, isolation, loss of purpose, those are all really good indicators that it's time to seek out supports. And it's important to know you're not alone in those feelings. The third kind of grief I want to mention for today is cumulative grief, because it's something that is so common for anyone who has a cancer diagnosis or is a caregiver or their loved one has a cancer diagnosis. Cumulative grief happens when losses pile up over time. So maybe that's from changes in fertility or changes in mobility, a career change, maybe it's a loss of a loved one previously. Each of these new losses can open up old wounds. So of course, this is incredibly common for people with cancer and their loved ones who have experienced loss before, which is pretty much everyone, right? And then you have this compounding effect with these new losses with the diagnosis, and it can feel really overwhelming, like they're carrying layers of pain that never really quite get to heal. The emotional toll can build up and be really quite exhausting and sometimes even feel surreal. So how do we think about grief? I always like to talk about the grief jar analogy. If you have talked with me about grief, I have likely used this analogy with you because I think it can give a really helpful perspective in sometimes what people anticipate and how to think about how grief is experienced over time. So if you're looking at the top row here, and imagine that the big ball in the middle is grief, and the jar is you carrying that grief. You can see in the beginning, it is, taking up a lot of space, and people tend to think that over time, grief gets smaller and shrinks. But, I think that can create some difficult expectations. I really like thinking about it in the second way, where the losses don't change, the grief is still there, but you yourself can grow around it. You can find ways to be able to navigate it a little bit easier, and you can find ways to bring it with you. Of course, there's no right or wrong way to think about it. I just like this analogy because I think it can give you some permission to not have to get over it, but find ways to move forward with it. How do we grieve? Whenever I talk about grief, there's usually someone who mentions Elizabeth Kubler-Ross's 5 stages of grief. So that's denial, anger, bargaining, depression, acceptance. And I always like to take a moment to say that, well, those are, of course, really common experiences when you're grieving. We know now that there is not a universal experience of grief. We know that grief is not linear. It's really important to remember that grief is a highly individual process, and people may experience some of these stages. They may experience all of these stages. Some people skip them altogether, and sometimes people go back and revisit them over and over again. Grieving, it's not a checklist. It doesn't follow a predictable path. Sometimes people will cry. Sometimes others like to keep busy. Sometimes people prefer to talk it out. And for some, kind of keeping to themselves, having that inward time can be most beneficial. So however you grieve, that is okay. It is a deeply personal experience. There's no real right or wrong way to do it. When people navigate grief, there's often this experience of two processes happening at the same time, and that can be a little bit confusing. Grief isn't constant. We kind of naturally move back and forth between focusing on loss and focusing on daily life. So one minute you might be feeling really overwhelmed, and the next you might be talking on a phone with a friend, laughing. Both are okay. And just because you might be feeling lighter or happy even for a moment doesn't mean you're not still grieving. Sometimes the roller coaster of emotions, that oscillating back and forth, can be really confusing, but it could also be exhausting. It might be hard to imagine, but growth and grief can exist side by side. Healing doesn't mean that you're forgetting or that you're okay with what's happened. A lot of times when I meet with people, they say it's hard to accept what's happened, not because they don't believe it, but because for them it feels like defeat in some way. And I always like to encourage trying to think about it as learning how to carry your grief while also discovering new ways to live, to connect, and to find purpose. So how do we cope with all of this, right? We've talked about what losses can happen. We talked about what grief is. What do we do with it? First, I think it's really important, as we've mentioned, to acknowledge the losses for yourself and what's happened. Giving name to what's happening, recognizing that you are, in fact, grieving can be really important. In addition, leaning into your support systems. So that could be friends, it could be family, it could be a support group of your peers. Those are people who get it, who you don't have to necessarily explain everything to. There's that shared understanding that could be really helpful through this. I always want to encourage to kind of reach out to your healthy emotional outlets, things like journaling, mindfulness, creative hobbies. They're not just extras. They can be really helpful tools for regulating stress and for building resilience. And lastly, professional help. So therapy is not just for crisis. It can help you process your grief. It can help reduce anxiety. And social workers, counselors, whether through here at Cancer Wellness, at your hospital system, they're a really great place to start for that. Let's take a look at some of these a little more in depth, starting with kind of acknowledging the loss. Giving yourself permission to grieve and trying to acknowledge your grief without judgment can be something that's really hard to do, but can create a lot of help mentally when you're navigating grief. Having to experience all these losses because of something that you didn't choose, didn't ask for, it's totally out of your control. It is hard enough. We make it that much harder when we are trying to navigate it by getting frustrated with ourselves, by asking what I call those like, why can't I, or I shouldn't be statements. And I hear all the time people saying, why can't I just be more productive? Or I shouldn't be having such a hard time with this. Of course, those are very common things to be thinking, to be feeling. But kind of starting to acknowledge that you're grieving, that there is a very real reason why you feel this way, can start to reduce those judgmental thoughts and help begin to navigate the rest of those thoughts, feelings, and emotions. Next, kind of tapping into those support systems and sharing your grief. Now, the losses, I do recognize that someone who experiences the diagnosis, those losses may be very different than the kinds of losses of a caregiver, a friend, or a partner, child, what they're experiencing. But there is still that shared sense of grief and loss amongst people often, and being open to acknowledging that what you are all going through is still a common experience, even if the underlying reasons are different, can be really helpful. I know in working with both caregivers and people with cancer, a lot of times people on both sides want to protect each other, right? Of course, that's natural. And so they don't always bring up the thoughts of loss or grief and those really difficult emotions. And while they can be hard to talk about, because people do experience losses on both sides, it can be really comforting to open up and say, I know, even if, experienced differently, we are both experiencing losses, we're both grieving, can provide a lot of comfort and kind of reduce those feelings of loneliness and isolation. So thinking about healthy outlets for yourself. If anyone was a part of my talk last week, you may have heard some of these, but whether journaling, meditation, yoga, listening to music, drawing, going for a walk, find whatever fills you up and make it a part of your routine. One thing I always like to suggest is trying to find a way to get out into nature. Part of the reason why we have our lovely hikes and walks here at Cancer Wellness Center is because of some of the research that's been done about this. It really has a tremendous physical and mental benefit to being able to process grief. There's a Japanese practice called forest bathing, not bathing like water, but bathing like basking in kind of the natural wonder and sense of beauty of nature. And there's a lot of research from Dr. Lee in Japan about the health benefits of that. So when you think about the ways that grief impacts our health physically, it can raise your blood pressure, it can kind of impact your heart rate, maybe have an impact on your GI system. And we know from research that being out in nature can actually help reduce all of those signs physically. So whether it's something that is truly being able to go out into a forest, or maybe it means taking a walk around your city block, maybe it means watching a YouTube video about nature, all of those things can be beneficial to thinking about, finding something restorative. But ultimately, if that's not something that's for you, like I said, maybe it's knitting, maybe it's yoga, find whatever it is that's going to be filling up your cup, so to speak, and make it a part of your routine. And I wouldn't be a good therapist if I didn't talk about professional help, right? So I always like to encourage people to consider therapeutic tools and resources. Therapists and counselors can offer tools to process grief approaches. There are many different kinds of approaches that can be helpful. And, as we've said, there's no one right answer, but a few things that we know that can be particularly helpful are approaches like acceptance and commitment therapy, narrative therapy, or meaning-centered therapy. All of these can really help process grief and help people find different ways to be able to move forward with what they're experiencing. As you can see with meaning making, you can find meaning in everything you're doing and kind of help shift the mindset of loss. And in addition to seeing someone, there are so many different kinds of resources from a technology standpoint, right? So things like the Calm app, Headspace, they have a ton of different kinds of meditations. A lot of people really like to use these to help sleep. If you're finding that kind of quieting your mind is really difficult. And they can help create that kind of mind-body connection. So, as we've kind of discussed today, grief, it can be emotional, but it can be super physical as well. And finding ways to connect your mind and body and kind of ground yourself back into what's happening right now can be helpful to be able to take things just one day at a time and process all that's happening. And then lastly, community resources. So there are lots of wonderful community resources like Cancer Wellness Center that are the fact that you are watching this today means that you are already doing that. So good job. But, maybe you have used our educational resources and want to try yoga. Maybe you've done yoga and want to try counseling. I encourage people to kind of seek out whatever it is that feels interesting, or it might be a good connection for them, and give it a try. I like to say that just because you can get through something on your own, doesn't mean you should have to. So, I always like to kind of end in talking about grief in the lens of self-compassion. As we've said, the first step in self-compassion is really recognizing the losses that you're experiencing and the grief that comes along comes along with it. Many people minimize what they're going through because, they think, well, at least I'm alive, or others have it worse. And of course, those things can be true, and so is how difficult it is what you're experiencing, right? Self-compassion begins with giving yourself permission to acknowledge what's been taken from you. You didn't ask for any of this. And even if it's intangible, even if no one else sees it, it's very real and difficult. And then there's that voice in your head, that inner critic, that you might hear things like, you should be stronger, you should be more grateful, you shouldn't complain. As humans, it is natural to be tough on ourselves, but practicing self-compassion means trying really slowly to replace that voice with a voice that's more gentle and understanding. So a practice that I like to suggest is try asking yourself, what would I say to a friend who is going through this? We never want to be harder on ourselves than we would on a friend or a loved one. So think about, what would I say, and say it to yourself. Another form of self-compassion is honoring your limits. Some days you might feel energetic, and that's wonderful. Other days, sometimes just getting out of bed feels like a victory. Your body and your mind are under stress, and respecting your boundaries isn't a sign of weakness. It's a sign of wisdom, listening to your body, resting when you need to, try saying no without guilt. And I know that's really hard. Um, it's okay to let go of those shoulds, right? There's no timeline for grief. It can be hard to feel like I should feel better, but that's not necessarily true. There's really no right way to cope. And there's no perfect attitude that you have to maintain either. Letting yourself feel what you want to feel when you feel it is okay, whether it's sadness, anger, numbness, maybe even a moment of joy. Those are all very normal and okay. So to close, I like to have people try to remember that self-compassion isn't indulgence. It's not being selfish. It's a form of self-care and it's survival. It's what allows you to keep showing up for yourself in the face of a truly life-altering experience. And it's what makes healing possible. So even when the wounds or the losses aren't visible, you can find a way to care for yourself and acknowledge their difficulty. Well, I really want to thank you all for taking the time to be here today and for listening. I hope our talk illuminated your experience of grieving, some of the many non-death losses associated with a cancer diagnosis. I appreciate you sticking with us through some of our technical difficulties. I hope it may have provided some starting points today to think about where to begin to navigate all of the losses associated with cancer. Thank you very much. Now, I want to see, I know Savina will be joining us here shortly, and if you have any questions, please feel free to put them in the chat. Thank you.
Thank you so much, Stephanie. And so far, I don't see any questions in the chat.